Hello, my name is Dylan Mercado. I'm a fourth year emergency medicine resident at Stanford, and today I'm recording this video as a reflection on my 2-week global health elective with Dr. Misha Fautis. She's my preceptor. So to begin, I would like to share a little bit about my background. I was born and grew up in Vietnam, and I came to America when I was 21. So I have a little bit of first-hand experience as a patient as well as a caregiver to my family members back in Vietnam. And I'm sharing this reflection to include my perspective from my experience in Vietnam as well as my experience as a U.S. healthcare provider and a physician. So first of all, I would start off to say that a global health rotation is so much more than just clinical experience in another country, and is even more than just an overseas vacation. So, from my reading and my observation from the videos that I read from the course, there are a lot of factors that play into the experience you will have throughout the global health rotation. The first one is safety. So you go on a 2-week rotation, a month rotation in another country. We want you to come back intact and happy and safe. So before you go travel, look up what is going on in that country. Is there any political unrest? Are foreigners targeted when you show up there? And also observe the local rules. So when you drive, make sure that you know the traffic rules. Do not break the local rules because every country has their own different rules. Um, the second thing about safety is the food. You are so used to the food in America, and the food in another country. Have you ever eaten before? Any food hygiene issue that you may anticipate? Are you gonna bring with you some, food poisoning medications to help support you through that if you have an issue with the food there, right? And then other things about safety that I realize is that common sense, right? A common thing being common, it happens everywhere. Do not wear items and bring items with you that are expensive and that can attract, other people to you and put your safety at risk. Also, do not go out at night by yourself. Do not go to an area that you've never been to before, right? And then I'm gonna go back about traffic to talk about traffic. So commuting, make sure that you Google Map before you start your trip to know how to get to work, how to get back to your dormitory, where is the local police station, where can you go to embassy in case something happens. So make sure that you know all of that and have that prepared before you go on this trip. The second reflection I have from this experience is culture. So, you are a guest to that country. Do not expect people to act like Americans because they are not, right? So, when you go to another country, you are the guest, you observe the rules and watch out for, you know, um, things that people like and people don't like. What are you expected to do and to observe? So those are the things that you should research before you go on the trip. The second thing about culture is language. Do the patients speak English? Do they speak the language that you're comfortable with to communicate with them effectively? Can you get a good history and perform a good physical exam? Can you explain things to the patients well enough for them to understand it? Right? So that is a big, big barrier for a lot of people who do global health rotations. Are you going to use a local staff to help you translate? And if you do, are you going to take time away from their actual direct patient care? Those are the factors that you need to take into account before you go on this trip. And the other thing about culture that I wanted to mention is food. So, um, what if you are a vegan from Berkeley and now you travel to Indonesia and all they have is meat and they're offering you a meat buffet in a very welcoming way? Are you gonna accept this invitation or how are you gonna decline this invitation. So, are you gonna bring some food with you because what you eat may not be available locally? And finally, about culture. Coming from a first-hand experience as someone who came from Vietnam to America when I was 21, cultural shock is important and is real. So if you've never been experienced or exposed to another culture, cultural shock is real and it can affect you and it can make you very miserable. So be aware of that, be aware of the potential cultural shock and how to cope with it before you go on this trip. The third reflection I have is about clinical experience. Unlike America, a lot of the countries that we go on a global health trip do not have primary care and they lack preventative care. So from the videos I've seen, so many patients have chronic illnesses that were not attended to. So for example, there was a case about an African man, middle-aged man who had chronic leg infection that the surgeon just had to cut off with an amputation because nothing was salvageable. So be aware of the potential of chronic complications of a lot of these diseases that you may not encounter in America. Clinical experience also can come from the war zones. So you may be taking care of a lot of patients who got gunshot wounds, whether or not they are gang members, whether or not they're involved in fighting. In fact, in the video that I watched, they also mentioned that multiple staff members could have been killed on the job. So that is a very unique experience that I do not think that training at Stanford would give me. Like I feel safe at work, and I have never felt that, oh, I'm going to the emergency department at Stanford and my life could be taken away in any minute. So that is not an experience I have here in America, which could happen in another country. And the other thing about clinical experience is the lack of supply. We have gone through the COVID pandemic. We know how horrible it was to not have gloves, PPE, goggles, and 95. Now that we're post-pandemic, those are easy to get, but that may be a luxury when you go to another country to do your global health clinical rotation, because they may not have the N95s you need, and you're taking care of a TB patient. How are you gonna prepare for this? Are you gonna bring some N95s from America to prepare for yourself in case they don't have N95 for you? So that is something that you should take note and be prepared. Another thing about clinical experience is the learning experience. So you may be a medical student, a resident, a fellow, you're in a training program, you're coming to another country to provide care as well as to learn, right? There will be local medical students and trainees. The fact that you're there, are you gonna take away their learning experience? You may spend 2 weeks or a month there and then you come back to America. What about the local providers? They need the experience, they need to know how to perform those procedures because they're gonna stay and they're gonna provide the care to those patients. So be aware of your presence there because it may affect other learners' experience. Um, and finally, for clinical experience, be aware of your own emotion, the potential emotional damage when you take care of sick pediatric patients. So in the video, I saw a very young child, African child, with a facial swelling from E. coli infection. This could have been easily prevented or taken care of when it was at an early stage, but this child was so swollen. So whenever it involves a sick child, it stirs up a lot of emotion in the providers. So just be aware of that. The fourth reflection I have is about ethics. All of the ethical points that we do in America, that we observe in America, such as autonomy, beneficence, etc., are all applicable to global patients, because all of these patients deserve equal quality of care within the local possibilities, right? Local abilities. And the fifth reflection I have is about patient safety, piggybacking on the, the, the ethics. So make sure that you communicate with your preceptor very well and very clearly about your goals, expectations of your background, and of what you are and are not comfortable with. So if you take care of a patient that requires a procedure that you have never done before, do not experiment on these patients by pretending that you knew how to do it and go ahead, like, stab the patient with a scalpel. Learn from your preceptor, ask for help. uh, just, very politely tell them that I do not know how to do this, but I've watched YouTube, I've, done a mastery learning checklist, but can you walk me through how to do it? And I would like to learn how to perform this procedure, instead of saying that I'm so confident I know how to do it, and just like quickly watch a YouTube video and then do a thoracotomy, for example. And finally, post global health experience is so important, and it can be real. I've not done a global health clinical rotation, but I've done culture exchange, and coming from Vietnam, I have some experience, of global health trips. So when you spend 2 weeks, a month there, taking care of patients, living in another country, different culture, different food, new friends, new language, and then you go back to your usual routine with all the morning commute, with your friends, with your colleagues who have no idea what the past month looked like for you. It can feel very isolating, and it can feel like you are withdrawing from this global health experience. It is important to take care of your mental health. Write down in a journal to reflect on your experience. Stay in touch with your friends, with your international colleagues and connections. Despite all these challenges, I think global health is an invaluable experience. You'll learn so many things, not only for clinical skills, but also culture, language. You will touch so many lives, and it will change your life. Thank you so much for listening to my video.